Hello everyone, for Meet Me Here and Meeting Point, I'm your host Marcelo Palermo. In this occasion, I want to introduce Dr. Mike Refaeian. We interviewed him about a procedure that is helping people all over the world regain their normal lives. We're talking about bone marrow procedure. The interview with Dr. Mike is going to tell you a lot about this innovative procedure that is going to help and keep on helping lots of people having well-being and recovering their health. Next, Dr. Mike Refaeian. The topic is bone marrow procedure. And I'm here with a very special host, a friend for many years, who's actually doing something very innovative and great in the field of medicine here in El Paso, Dr. Mike Refaeian. How are you doing, buddy?
Doing good, Marcelo. How are you doing?
I'm happy to be here with you at your office here at your clinic. Yeah. Tell us about this revolutionary stem cell therapy that you guys are offering here.
That's a great question, Marcelo. I think in this region, we are the first clinic that does this on a full-time basis.
First clinic.
Nice. A lot of doctors do partial, like a PRP, things like that. But I was trained with a company called Regenix in Colorado and also Cayman Island. It's very scientific based. They have analyzed data from 150,000 cases since 2005, and they come up with a specific protocol to do certain type of injection to prevent surgery and improve function and decrease disability. Doesn't work for everybody, but the rate, as far as I know, is about 70 to 75% improvement.
Very interesting. And as you say, it doesn't work for everybody, but it works for most people.
Yeah, it does. It works for most people if the case is not too horrible, too advanced. Let's say, for instance, the rotator cuff tendon, the shoulder, a lot of people have problems with shoulders and they get surgery. If they have a partial tear, that works for most of them. If it's a full thickness tear, as long as it's less than 1 centimeter, that can still help. But let's say if it's a 4 centimeter complete tear of shoulder, they need surgery more than likely. Mm-hmm. But this is an attempt to prevent surgery for many, many cases. And the side effects are minimal. Infection, bleeding, we have to clean everything up and do it under sterile fashion. I use guidance, which is an ultrasound guidance, to guide my needle exactly to a right place. And I think we have a patient now. We can show you more or less how it's done. And we also have a fluoroscopy with X-ray machine, live X-ray. We can also guide our needle to a right place. It's not just important to be able to extract the cells from, let's say, from your bone marrow or from your blood, but it's also important to place them exactly where you need them to be placed.
That is very interesting because there's a whole process since you extract the material from the bone marrow, and then it turns into this stem cell that's going to help people regenerate tissue, get better. And you were telling me before that, as a matter of fact, this therapy helps with different cases, health problems, maybe back problems, knee problems, but also helps regenerate organs and things like that.
Yeah, it does. It does. Some university, let's say University of Miami or other ones in California, they use it for somebody that had, let's say, a heart attack, and they want to rejuvenate the heart cells. They use it for various neurologic problems. But I'm not an expert in that. The only thing I know is musculoskeletal pain. I do somebody with a knee arthritis, torn cartilage in knee, ACL torn, medial patellofemoral ligament that we've been injecting that also help. The ankle pain, the hip, several hip I've done. Several spine cases, neck and back pain. One gentleman came from Midland a few months ago. He was told he needed to have a fusion. So we did 2 sets of these injections, and then he says he's doing a lot better. We haven't seen him for follow-up in 6 months.
Well, that means he's doing better.
He's doing better, yeah. But
and you prevented him undergoing surgery.
Fusion surgery, yes.
Fusion surgery, which is
big surgery.
Quite something.
So basically what I'm saying is it doesn't work for everybody, but if it does work for several patients, imagine the cost of surgery, indemnity, the complication that you can go through.
Pain, mental,
physical.
Breakdown, everything.
Oh, yeah, anesthesia. Risk of anesthesia can also be very, very
significant.
Bad.
Yeah.
Significant, yeah.
Well, as you're putting it, basically you can help pretty much most of people.
Yeah.
And the fact is, we were interviewing William, gentleman who wasn't paying for like around 15 years after a very severe vehicle accident, car accident.
Yes.
He was working in law enforcement. And after those 15 years, just a couple of months ago, he underwent this therapy that you offer.
Yeah.
And now he walks, he's around, he looks fantastic. It's like he literally told me that this therapy that you guys saved his life.
Yeah, it's very nice of him to say that, but his spine is pretty bad based on the MRI. Severe degeneration throughout the lumbar spine, so we have to do very extensive injections. You have to sedate for that kind of injection.
Yeah.
But we basically penetrate all the important area that we need to penetrate, including the facet joint, the arthritic joint. We inject them with plasma lysate, concentrated platelets, which could be like 14 to 20x depending on age. The older you are, the more blood we need to take from you so we can concentrate it and then inject to a right place. But I'm glad it worked for him. We also did it several other patients, one young patient last week in the 20s with a disc herniation. He says he's already feeling about 50% better.
Tough. Amazing. So, Mike, and you work in your clinic, and you're also going to open another clinic in the west side.
Yeah.
You have east and west.
Yes.
That's happening in September, right?
Yeah, September. It
Very
takes
soon.
several months for it to remodel, and hopefully we get it ready by September, early October.
Very well. So can you provide us with your clinic information?
Well, that clinic is on 7860 North Mesa. So it's by Mesa, like way west.
Yeah.
This is going to be on the east side. So for patient, it would be more convenient to go to one versus the other location.
Exactly. And this one is located at?
This one located close to Yarbrough, Vista del Sol, and Sumac is 10412 Vista del Sol Drive. Phone number, in case anybody needs it, is 915-593-9300.
Fantastic. Dr. Mike Refaeian and the innovative and wonderful technology of stem cell, which is ready here for you. You guys come over, check them out. If you have any of those problems, and many people do here in the region and all over the world of the country, you just talk about a patient that you have from the northern states, right?
Yeah, I have patients from all over the world. They come
Fantastic.
in, even some from Dubai. They come.
Wonderful,
Yeah, so there's like
wonderful.
it's
Well, we have
international.
some fans maybe here in Dubai and Qatar. So wherever you guys are, you're going to have it for sure here. Good treatment, something that can actually change your life for the way better. Now I'm going to introduce Blanca Garcia. Blanca Garcia is a technician helping Dr. Mike Refaeian with the bone marrow procedure. Let's listen to what she has to say regarding this innovative procedure and how she helps in the whole process. We're here with Blanquita. Blanquita is a technician and a medical assistant. Blanca, well, introduce yourself, please.
Well, my name
Hi.
is Blanca Garcia. I'm in charge of the stem cells program. I'm usually the one that processes all the blood and the bone marrow, the magic.
The magic, yeah. The magic that is not magic. It's
Yeah,
actually
the magic,
technology and medical advancement. But
Yeah.
it's cool to call it magic because
Right.
it really brings miraculous and almost miraculous results, right?
Right.
So how do you process it?
Well,
And how
first-
long it takes? Also?
It takes the bone marrow. It takes about 4 hours.
Wow.
The first one, the first hour is for us to aspirate the bone marrow. After that, it takes about 3 hours for me to process the actual bone marrow, count the stem cells, and make sure that we're gonna do the right procedure, the right amount. But it all depends on the patient's age,
Correct.
weight,
Condition.
how degenerative it is.
Yeah, exactly how the condition is. because
How the
maybe
condition
a
it is.
knee or the back, especially. And so you extract what it's going to become the stem cells from the bone marrow. Right?
Yeah, once he gives me the bone marrow, I'll process it, and then
process
I'll
it.
count the stem cells and make sure that we have the right amount.
Quite a procedure, and you say it can take between 3 to 4 hours, right?
It takes 4 hours.
4 hours, 4 hours. There you go. So, Blanquita, there's different patients or people with different health ailments or problems that are actually benefiting from this wonderful therapy. Can you tell us about that?
Well, people that are hurting like from the knee, the lower back. We've done cervical too. We had one guy that we did the cervical. The next day he went to Juarez. He said he had no pain at all, and that's
the
good
border
for us. Those are great news for us because that means that we're
Exactly.
doing a good job.
Exactly. So mostly those patients, and again, as we were talking before about surgery, and the fact that with this therapy, in many cases, you can avoid surgery and then avoid the complications.
These patients are patients that they're trying to avoid surgery and they're in a lot of pain. So they tried this procedure first. If it doesn't work, then they'll try to do the surgery. But in most cases, it's successful.
Yeah, you will say that what's the level of success when it comes down to this stem cell procedure?
About an 80%.
Well, that's
80%.
a high rate of success.
Their pain sometimes on the first injection from a 10, it goes down to a 5.
That's
so
a
which
lot.
is 50%.
That's a lot. Well, consider nice to consider. And well, Blanquita, if people wants to get informed, I mean, they should visit you. Can you give us a phone number, direction, address?
Yes,
I mean,
the phone number is 915-593-9300, and they can always ask for me. And the address is 10412 Vista El Sol, Suite 1B.
the clinic name? Yes.
EASTSIDE Rehab and Pain Clinic.
EASTSIDE Rehab and Pain Clinic. Thank you, Blanquita.
Thank you so much.
Great job. And of course, I hope you guys enjoy this. You know, EASTSIDE Rehab and Pain Clinic right here. I'm Marcelo Palermo, your host. See you soon. Present an interview with Dr. Mike Torres. Dr. Mike Torres helps with recovery after bone marrow procedures. Dr. Mike Torres, here's the interview with Dr. Physical Therapist Mike Torres. He's actually in charge of rehab, of physical rehabilitation, after a person gets a stem cell injection or goes through the steps of stem cell therapy. Mike, how are you doing?
Pretty good, thank you.
Well, your task is really important because after this stem cell therapy goes through, it's a one-time therapy, people actually has to go through physical therapy, and that is to get stronger, get back in shape, regain confidence. Tell us about it.
Yes, sir. The majority of the people that require the stem cell injection are usually people that have had chronic pain, that have been dealing with this for quite some time. So they've been avoiding movements, avoiding exercise, and in turn, that area that's affected has weakened over time. So usually after the injection, it's very important that they go through a course of rehabilitation. That way, if the pain reduced, then we can start recovering the area that's injured. And since they have been immobilized for a while due to the pain, that muscles have atrophied, joints have gotten stiff. So it's very imperative that they go through a rehabilitation program to strengthen and recover the motion that they've lost over time due to the chronic pain. And then once the joint has been rehabilitated or they've gotten enough strength, the goal of the rehab is to get them off in an independent home exercise program to where they can continue on their own in the gym or at home. That way they can maintain the gains that they've recovered since the injection.
So therapy will not end here in the clinic and nothing. Afterwards, you not only encourage, but actually motivate and encourage people,
yes, sir,
to move forward and keep on having this therapy and to keep on physically being active.
Yes, exactly. Because in the long run, you know, if their pain goes down with the injection and they recover, they'll be feeling better. But if they don't continue, with the activity and with the strengthening, they might start losing the effects. And in the long run, especially if it's a joint that's degenerated, they can start feeling the effects of that once again, especially if they don't maintain the strengthening around the joint to support the joint like we initiated during the rehab process.
Technology and knowledge come together for a better way of living, and we thank Dr. Mike Torres for this information.
Thank you.
Thank you, Doc. I'm Marcelo Palermo. This is your podcast, and meet me here. Keep on being with us. Thank you. This interview is with a patient of bone marrow procedure, a person who not too long ago had a very bad car accident, and recovering was pretty much seemed to be out of the question. Well, he met Dr. Mike Refaeian, underwent a bone marrow procedure, he got his therapy, and now he has recovered. Next, he will tell us about his journey from not being able to live a normal life to regain full control of his body. This is an interview with William Burt. Hey, I'm Marcelo Palermo. We have a very interesting story today. We're going to talk about stem cells, and we have a fantastic testimonial. How are you doing today? And please state your name and last name.
Doing fine, doing much better. My name is William Burt.
William, you had a tremendous experience that actually take you to see and meet Dr. Mike Refaeian, and literally took you from years of pain to no pain. It's an odyssey, we can call it that way, right?
Let's say it was a life-changing event. It's a life-changing event that I think there's a lot of Americans here in the U.S. are looking for an opportunity to take. My event started in 2009 and me involved in a motor vehicle accident in a police unit in which I was hit by an individual traveling about 70 miles an hour. I broke 2 discs in my back, L4, L5, cracked them in the middle, and created a bulging disc in both the L4, L5. And of course, there was other injuries sustained. I had a kidney injury, and which lasted about 3 months. But needless to say, shortly thereafter, I was in serious pain all the time. I must have seen probably 4 surgeons, changed probably 3 or 4 orthopedic physicians who constantly reviewed, their tests, their results, and it was always the same answer: surgery and boxing the L4, L5. And I was still in a career that I really loved, and I just felt that doing that type of surgery would have caused me to have to exit that career. So I refused to do it. Besides that, I had several friends of mine who were physicians said that that probably wouldn't end very well and would probably end up in more pain than I already was. So it wasn't until about 2017 that I finally was introduced to Dr. Refaeian, as you know, who's a pain management. And prior to that, I was on hydrocodone and probably every other muscle relaxer you could think of. But I think, as you know, in law enforcement, that keeps us from taking those type of drugs. And so it was real painful. It was a constant pain. I couldn't do activities with my family, couldn't engage in any sports, running, walking, which caused me to be overweight. By the way, that made it worse. And so, like I said, in about 2017, I was introduced to Dr. Refaeian, and then we started doing other things. We tried epidurals, and of course, those type of procedures only lasted for about 3 months, and then I was back to square one, which was of no fault to Dr. Refaeian, but at that time, that was all that was available to most people that had my condition. Okay. It wasn't until 2021 that I think PRP, which is the plasma, it was introduced to the medical field, in which Dr. Refaeian did the first procedure on me, and that went very well. I think that the pain level was reduced to probably 3 to 5 on a maximum, but it only lasted for about 6 months. And I think even during that time, the sciatic nerve was just raging, where to the point where the nerves would pop out in my calves, and again, there was no relief. But the plasma did help, and we continued to probably do 2 or 3 of those, and it wasn't until I believe 2023 when Dr. Refaeian certified in stem cells that that he got all the equipment and everything, and he started doing the stem cells. And it wasn't until just April of 2024 that Dr. Refaeian performed the stem cells, a one-time therapy. And I thought when I got up that, there would be that lapse in time of feeling the effects, but no, actually, when I got up, I had more pain. And so I said, well, it's probably from the general anesthesia that he gave me, and I said, wow, this felt really good, and No, actually, a week went by, and I'm thinking to myself, okay, when's it going to kick in? You know, when's the pain coming back? But here we are. We're in June, and to this point, I recently had heart surgery, and the doctor required me to walk a mile, and this is the first time in over 20 years that I've been able to walk with no pain. So it was actually a life-changing event.
So basically, you went through a lot health-wise speaking after that fateful day of the accident back in 2009. That's what we were talking before, came all over the news and everything because, by the way, you were law enforcement.
That's correct. It wasn't in news. It was a horrendous auto accident that basically totaled the vehicle, as you know, and I guess it was a God-sent opportunity to stay because I should have died in that accident.
Yeah.
And but I didn't, so I'm still here.
As you told me, even you had a gun. It was a 45, right? And you told me that gun popped broken.
Oh yeah, I had
as a consequence.
As you know, when anything can happen, it will happen. And so I had a brand new 45 that I purchased probably that year. And of course, you know, back then we used to build the units with a post in the middle with a computer.
Exactly.
Well, I happened to, because of the accident, it got pushed back and got shoved into my right side. And if it wouldn't have been for the weapon, it would have probably punched a hole in my kidney. I bled for like probably 3 weeks. It damaged the kidney. I was bruised kidneys. But the weapon was bent to the extent I sent it back to Colt and I told them that, you know, I was in a police unit MVA, and of course they sent me a brand new gun thanks to Colt, but it was replaced. That's how hard the impact was. So,
and being that hard, after that came 15 years of health problems and situations that actually had you dwindling down, kind of brought you down to a simmer because you were in pain, as you were telling before, taking controlled substances that were prescribed to you because of the fact that you have severe pain until this happened.
You know, I actually retired in 2012.
Correct.
And I think after 2012, my health went down astronomically.
After retirement, you're ill.
Yeah, I mean, I got to the point where the mobility was like, walking was an issue, wearing a gun belt. It was horrible.
Right.
I mean, there was nothing I could do. I mean, like I was telling you earlier, I couldn't walk more than 10 feet and I'd either have to sit down or lean on something. And if my family wanted to go to the mall, and I had to sit on the bench while they shopped.
Correct.
You know, I couldn't do any of those things. Fishing, hunting. I mean, I was a lifetime hunter, and you know, it got to the point after I retired, I quit hunting, I quit fishing.
All those physical activities, I guess that they were absolutely off limits after you got this back problem as a consequence of the accident.
Absolutely, absolutely. The stem cells, like I say, I was amazed. I really, truly was, because I have done so many things. I've always had health insurance. I was very blessed, but the health insurance couldn't do anything for me because it couldn't do anything to resolve this other than surgeries. And like I told you before, they said it would probably make it worse because of the type of surgery that was needed. It was to cage the vertebrae. So that was out of the question. I just think the mobility was going to even be worse and the pain was going to be worse. I just never chose to do that.
So we're talking about this long time, lengthy time of you suffering all those pains and hindrances and problems. But recently, just 2 months ago, April 2024, you underwent this one stem cell therapy.
Yes.
You thought it was the anesthesia, probably, or something like that.
Right.
But no, complete switch.
It was a complete switch. It's like it was on off. And it was from the time that I got off the bed there, and started to put on my clothes. You know, you got to understand that, and during this duration of attempts, you know, we're talking all the epidurals, and 6 or 7 years that I did, and then plus all the PRPs that I did, which was about 3 or 4, they're very painful, by the way.
They must be.
Because these aren't general. Most of those were in and around the vertebrae. And so anytime you get into those sensitive areas, it's very painful. So the minute you got off the bed, you know, you were in pain. You were going, man, I hope this gets better. And then, of course, you know, the following day, and sometimes, you know, it would take weeks for the effect to happen. But yeah, I get like 3 months of relief. But after 3 months, I was back to square one. So, but it was an opportunity to get some relief.
Exactly.
But the sciatic nerve never gave you relief, by the way. That's the most horrendous pain that you can have, because it's there day and night. It's like a buzzing sound in your ear. And then again, your foot and your calf, you know, they're on fire all the time. And you're going, man, it's actually, it can actually, I can see people being depressed over that. There are people that get severely depressed because this gives no relief. But I just have that type A personality where I'm just a go-go type of person. If I didn't have a busy schedule, I imagine that I could possibly become severely depressed over it, because it never ends. I mean, it's always buzzing. But the sciatic nerve, and I think that the doctor was explaining to me, Dr. Refaeian was explaining to me, that now they've gotten to the point where they can actually separate the stem cells appropriate for each individual injury. The muscle, the cartilage, the nerves. And so I thought, well, okay, go for it, you know. And I'm here, I'm living proof, and I'm sincere, because I'm so grateful that he changed my life. I mean, I'm back with my family. I told you, I just had open heart. I'm able to walk now. This is the first time in 20 years that I've been able to walk a mile since the injury. And I used to run 10 miles a day prior to the injury. So I was physically in shape. Of course, I was much younger, but I wasn't a person that was overweight or anything like that. I always ran, went to the gym. But after the injury, it's just that was gone. I mean, you couldn't. But now I'm able to. Like I said, again, the life-changing event. I'm able to walk, and you know, my hopes are to get back in the gym and start working out again. That's my goal.
We might go together. It will be a great honor. And by the way, before we wrap up this interview, I would like for everybody who's going to be watching the podcast, and of course also the medical shows like Consulta Médica, medical consultation, could you stand up to show everyone how great you look?
Oh, absolutely.
Ladies and gentlemen, that's how proper stem cell therapy puts you back on top of the world. And it's been a great pleasure talking.
It's been a pleasure talking to you. I hope this helps other people.
Exactly.
I really hope so.
And most definitely we'll have to do other interviews and talk more about your daily activities. And when you get back to the gym, probably the idea will be, if you let me know, I'll go with you.
We got a date. Thank you.
There you go. Thank you very much, guys. Again, meet me here. You know how this is. I'm Marcelo Palermo, your host. This is your podcast. See you soon with more, probably from the gym next time.